I appreciate y'all being here. I appreciate the library for reaching out for this collaboration. I know we have some faculty and staff on line, and so again, I want to thank you all for being here. This is a topic I am actually pretty passionate about, coming from somebody that really did not like presenting and public speaking for many years. And I think a lot of people are that way. Very few people I know were like, oh, yeah, I want to be in front of people all the time talking, right? But really talking about today, hoping to provide you all with some takeaways in terms of presenting, especially around scholarly activities, but really just want to equip you all with just some really good general tips in terms of public speaking. I think when we can kind of be more comfortable talking in front of others, we tend to do a little bit better when we are doing more formal presentations and things like that. So first and foremost, I want to introduce myself. My name is Cassie Jo Ardrey. I serve as the director of the Career Readiness Center here at UNT Health. I've been here since 2020. Came in the middle of the pandemic, learned my role completely virtual, then meet my team. And so public speaking, communication is really important these days, especially when a lot of us are in person and virtual. And so these types of topics are really important for us to really dive a little bit deeper and again, understand the importance of wanting to show up well, wanting to present well, wanting to engage with folks at a high level. So I'm excited to chat with you all today. So really going to chat today, like I said, some general tips around public speaking, and then really helping you all kind of lock and load if you have already presented or you're hoping to present in the future, kind of some of those key points in things that you want to focus on, especially if you're not feeling as confident as you would like. So objectives, learn how to structure the research presentation, right? It's going to be very similar, like intro, how are you going to engage your audience? How are you going to present the information, the wrap up, things like that. So we'll go through the actual breakdown. Again, talking more about that communication. A lot of what's important, especially when you're in front of folks and you are obviously trying to transfer information, is your nonverbals, right? And so a lot of times that is going to require you sometimes to be a little bit more mindful of your posture, your eye contact, your facial expressions, things like that. And so you want to keep your audience engaged. And we'll talk a little bit more about that. Again, I mentioned general public speaking strategies and also understanding your audience at the time, because that's really important as well. And then I'm going to tie in my office in terms of making sure that folks are workforce ready, career ready. We have several overarching organizations that help guide us, the bridge between the workforce, industry, and colleges and universities. So these are us working in conjunction with what employers, what workforce, what industry needs, and what we need to be doing right now while folks are in school, going through training in their education. And so we'll talk a little bit how those things can connect today in terms of those career readiness skills. So just a quick overview of my office. We assist students with anything career development related. We also work with alumni. Once you are a student at UNT Health, we work with you forever. You have access to our office. I have been known, wink, wink, to work with faculty and staff as well. That's kind of one of my passions. So in terms of my actual full-time role here is to support our students, but a passion of mine is also to help develop our faculty and staff in any way that I can. So again, that's resume, CVs, mock interviewing, networking, looking at your LinkedIn, salary and benefits negotiation, kind of walking through that process. Obviously, job fairs, career fairs, job search, exploration. I also do assessments. I'm certified in several different areas for assessments. And then another key offering that we have is especially for students that find themselves leaving the institution either by their own accord or maybe they've been dismissed. And so we work with those students to help them transition out. And again, if you've been a student here, you would have access to our services for a lifetime. So why do our presentation skills matter? Obviously in healthcare, but if y'all were to if you were presenting somewhere, why do you think it's important that you have a higher level skill set or confidence in presenting?
Inspire confidence.
Right. Inspire confidence, right? You are eliciting, if you're in front of people, they're assuming that you're some level of expert or you know something, right? And so being able to show up in that way is also really important. It's not just the actual information that you're transferring, it is also your ability to reinforce that level of expertise, that level of knowledge. That's the key kind of posture towards this, right? So some of the ways also why it's really important is, communicating your research can also improve patient outcomes. Strong presentations can actually influence policy. And so when we think about like your ability to do something well, there's going to be a lot of stakeholders in the room, right? Why would they be coming to watch your presentation at a conference or something like that, right? They're interested for whatever reason. And then again, whether it's residency, fellowships, those types of things, your ability to stand up, share knowledge, share patient history, that kind of stuff is going to be very, very important as well. So again, I like to talk about this in terms of like exposure, right? The more you do it, the better you get at it. And even when you're really uncomfortable doing it, it tends to be less and less scary as you will realize the more often that you do it, just by doing it, you're going to gain confidence. So I just want to remind everybody that for those that aren't super comfortable in that space, that the more that you do it, it actually does, that exposure allows you to really realize, hey, I'm not going to die from getting up in front of people, right? No one's going to make fun of me. No one's going to throw, tomatoes at you or whatever it is. And so I always just try to kind of lighten that nobody is going to do anything so awful that we can kind of conjure up in our mind that the worst case scenario might look like. So as I mentioned earlier, NACE is one of those organizations in terms of career competencies. One of the biggest ones is communication, professionalism, and the technology piece. And I think those are the key components we'll probably be talking about today. So your ability to engage in all three of those areas at a high level. Again, these are overarching themes that NACE lets us know, hey, it doesn't matter what role, what company, what organization, or what industry, each one of these competencies are an expectation of employers, right? So when we talk about you being able to show up and communicate well, or think critically, maybe when you get a follow-up question during a presentation, right? All of these things are going to be key competencies that no matter the role that you might have, that you will be expected to, again, be competent in. In terms of the competencies, again, that talking through presentations, I think, I mentioned 3 of these, but again, your ability to show up in these areas is going to be key to being invited again, continuing to do presentations, things like that. I will speak from my own experience. I presented at a conference in Portugal back in November in student affairs, and working in terms of AI integrating into career readiness in terms of healthcare professionals. And when I submitted my proposal, I was like, there's no way I'm going to get picked to go do this presentation at this international higher education student affairs conference. And I was like, well, if it's already a no, then I might as well still put my name in the hat. And so I ended up getting selected. And just to say, when we talk about presenting, that was kind of one of those things for me that I was like, man, that would just be really neat. And I feel like I have something good to say. I feel like I have something to share with my colleagues that do similar work that I do. So I share that out with you in that me doing that has prompted other folks in my division to consider doing the same. And so I think sometimes when we're courageous and we step into those spaces and we're like, oh, I don't know if I'm really ready, or I don't know if I'm going to be selected, just by doing that encourages other people to try and show up in a way that they hope to, and build that confidence through watching you do courageous things. And so I just want to reiterate that, because I do think that that's really important in terms of leadership. When we do scary, courageous things and other people see us do that, they feel a little more safe to potentially step into those spaces. Again, just kind of going over, I mentioned earlier, in terms of communication, right, being able to articulate information well with your audience. obviously knowing your audience, right? Again, staying away from jargon, things like that is going to be really helpful in terms of being very explicit in the way that you are presenting information. Obviously, I think we all enjoy some visual aids, right? It's fine for people to talk with us. Not a fan of people talking at us, but always having some sort of visual aid tends to really just elevate the presentation, right? So this could be a poster, this could be a literal item, it could be a photo sometimes. And so again, just reminding you that that really does help elevate a presentation, no matter the space that you're in. And then interdisciplinary audience. I love all of the academic programs that we have here on campus because it really does allow for some really robust collaborations. And so being able to tie the work that you are presenting or that you are speaking to in a way that might impact more than one population that's there, right? It might be a very specific research topic, but that doesn't mean that somebody else that's there couldn't get something from it, right? And so being mindful of that and being mindful again of your audience is going to be really important. The critical thinking, so right, your ability to interpret your own research findings, right? And what I mentioned a minute ago, those like follow-up questions, right? So not just being able to, right, give that information to somebody else, but being prepared to receive feedback and being ready to answer those types of questions is really important too. I think a lot of folks just focus on, okay, I'm going to get up there, I'm going to say the things I need to say, but I'm not necessarily prepared to have some sort of engagement or interaction, right? And so I think a key piece of that is being prepared for any type of follow-up question that may come, right? So imagine yourself presenting this information. I could also imagine somebody wanting to ask a follow-up question to this, or I find myself thinking about this next level type of thinking around this. So I think that that's super important. Obviously, your methodology and your evidence. It goes without saying, you obviously want to be, again, very explicit in that. And then connecting results to the healthcare practice, right? So I think that a key component of that is like, not only are you presenting the information, but are you also connecting the dots and painting the picture? Why did I do this research? Why is it going to be important? How is this going to tie into the work that we're talking about, right? So again, it's kind of a key element of storytelling, if you will. So learning to be a good storyteller. We hear a lot of that around data. Data tells a story, but you can show all of the data, but if you aren't able to paint the picture as to why the data says this and what we hope to do with it, that doesn't really give it the same level high impact, right? And so your ability to articulate that and share that out is also going to be really, really important. So leadership and professionalism, full disclosure, I don't really like the word professionalism. I like the word professional responsibility. And there's a lot of reasons why, but mostly professionalism has a lot of overarching aspects and it's very complex. But when we talk about professional responsibility, we're talking about taking ownership of how we show up, right? And so I'm going to use that word over professionalism. So when we talk about leadership and professional responsibility, right? Being confident. So I'm sure we've all maybe seen somebody present that may not have elicited a lot of confidence, right? You can tell they're really nervous. Their body language is showing you that, you know, maybe their speech is really sped up. Maybe they're not breathing. Maybe they're physically shaking, right? Those types of things. Those are all normal behaviors, right? Like I said, most people aren't like, yeah, let me get up in front of a room of 150 people. But when we talk about being able to do that confidently and get into that space of uncomfortability and still be able to do it and do it at a high level, that's really what we're talking about. And again, this typically comes from the more you do it, the more confidently you'll be able to show up. Again, I'd already kind of mentioned you being up there doing that in a confident way is absolutely going to impact decision making, right? Whether the information that you're presenting, but if you do it confidently, again, that is eliciting your expertise and solidifying why you're there talking about that topic. So remembering that. Professional responsibility, again, this is ethical presentation data, right? You don't want to overinflate, you don't want to oversell anything, you don't want to skew any of the quantity of anything, right? So when we're talking about making sure that you are ethically presenting your research, that we're doing just that, right? You know, I say a lot of times, are there going to be many people that would like really go back and double check that? Probably not. But if they did, I would really hate for them to find out that you've overinflated something, right? And again, that again would just completely shatter that that confidence in your ability to not only do research but to ethically do that. Credible and respectful communication. I am a pretty, I say relaxed, I'm a pretty conversational speaker. My default isn't to be in formal communication with most folks, right? Obviously, I can read the room, know what type of presentation I'm doing, and acquiesce and adjust to that. However, I think knowing yourself, right? Are you more of a formal speaker? Are you more of an informal speaker? And being able to kind of capture that in the time that you're presenting, right? Or if you feel like, hey, maybe I am a little too formal and I want to be more conversational, I want it to be more engaging, you can work on that as well. And shameless plug, we do work with students on doing this exact thing, right? If you want to come practice, just like we would practice a mock interview, we can practice these different presentations and being able to provide guidance and feedback on that as well. So that's something that you find that would be helpful to you, please make an appointment with my office and we can definitely assist in that. Okay, so mentioned earlier the structure, right? So very, very similar to, any presentation, right? You're going to have an intro. Typically, it might be a little bit about yourself. It's going to be a preface to obviously the research that you're going to be presenting. You would then pose the research question or a research question, and so you might ask the audience a question about whatever topic it is that you're presenting. That in and of itself is a great way to hook engagement very early on, is really starting that kind of conversation around posing a research question. You would then obviously share out your methods. So how you gathered your data, what were your results, right? How did the results turn out? What have you articulated from those results? And then opening up for discussion and then the feedback, right? So I think it's important that once you present information, that you also leave space and time for that Q&A, those feedback questions. I think a lot of times it's easy to think about, okay, well, I'm going to go do this poster presentation. I'm going to facilitate this information and then, okay, I did it, right? But that's actually just one part of it. The other part of it is your ability to continue to have a conversation about, to be able to provide additional information when those feedback questions come. And so making sure that you, are prepared to have those follow-up questions, but also that you are open for that discussion. And then the closing, I think, and I didn't necessarily add this in here, but closing, right? So just as you do an intro, you also want to close out your presentation, right? And so that would be something similar to thanking the audience that's there, probably providing some contact information. If you want to connect with me on LinkedIn, here are some links to some of my other research if you're interested, right? Maybe providing some action items, some materials, things like that. So again, making sure that when you are actually physically closing out the presentation, that the audience has something to walk away with, whether that's contact, material, further reading, right? Action items. So again, that really helps them literally walk away with something other than the knowledge they gained, right? They're going to walk away with something. So that's really important as well. And then obviously tying it into healthcare is going to be important as well. So strong introduction. A lot of times after your personal introduction, who you are, where you're from, a little bit about yourself briefly, establish context, right? So sometimes that may be, like I had mentioned earlier, posing a question to the audience, right? So can you all imagine that, in today's healthcare landscape, the idea about, and I'm just going to go with AI here, the idea about integrating AI into healthcare for some can be concerning, right? So you're kind of leading with a bit of the topic, but not really letting them know really exactly where you're going with it, right? So it can pose a question, you can ask, you can share something, a personal experience. So again, these are some ways for you to establish context into what your actual topic's going to be. It's not just like you being like, okay, here's what I'm going to talk about. Explain the problem or the gap, right? So I'm here because I was in my undergrad and I noticed that there was this gap between X, Y, and Z. Therefore, I wanted to find out more information, which really allowed me to dive a little bit deeper, get connected with folks that were doing some research on this, which led me to this project, right? So again, kind of letting them know how you got there, and then hopefully how you're hoping to solve the problem or the gap, right? Like that's the hope. I would imagine that we would all be doing some type of research to, again, gain more knowledge to fix a problem or a gap. So again, making sure that you are providing that information, right? So clearly stating the research objective. Why am I doing this research? Why did I choose this topic? Why is this the theme? Why is this important to me? Why is this important to the community, right? So really being able to, again, articulate, paint the picture, why it's important, why I felt it was important to do this type of work or do this type of research. And then again, as I just mentioned, really helping others understand the impact of the research in the healthcare realm, right? And so when we're talking about, whether it's determinants of health, whether it's patient outcomes, whether it's just, finding a potential cure for a disease, whatever it is going to be very important that you are able to connect the dots, tell the story as to why I chose to do this. Here's the gap that I was hoping to find. Here's the information that I found. And now that I have this information, I'm hoping to do X, Y, and Z, right? So you kind of see the linear line of why I chose to pursue this. So again, that's just helping the audience understand who, what, when, where, and why. Okay, so key elements, right? So focusing on the key elements, a lot of times when you do have some sort of visual aid, that's a really helpful way for you to kind of track your topics and putting them in a way that is helpful for you to actually go through those prompts and through the different topic areas that you want to discuss. Participants, right? You always want to share out that data. How did you gather your data? How many participants did you have? What was your methodology, right? So making sure that, again, you're emphasizing that information. Again, you may get additional feedback questions on that. So being prepared to ask questions. Hey, how did you go about your survey distribution? Those types of things. How are you able to tap into getting access to this organization, right? Things like that. So again, and I mentioned this earlier, technical jargon, right? You want to be very explicit. You don't want to assume that everyone there understands all of these terms, or if you're using acronyms, things like that, you want to just be, you want to use the full word. And so making sure that you are being mindful of that, that maybe not everyone in your audience would be aware of that in terms of all of the verbiage that you might be using. So highlighting the most important findings, right? Like we know in research, there's lots that goes into that, right? But what are the high level, high impact outcomes of the research, right? Or whatever the topic is that you're trying to present. So again, that actually takes critical thinking skills to assess that, to know, okay, well, I have all of this different data, but here's ultimately what I was hoping to find. What do I really need to be discussing and talking about, right? So again, being able to articulate that, think through that, really being able to formulate responses and delivery around those particular findings. Again, using visuals is always helpful versus a lot of text. I think especially, I keep going to a poster presentation, but I do think those are so helpful because you have a little bit of everything, right? You have your visuals, you have charts, typically you might have some photos, but you also have actual data there, right? And so for me, that is, in the way that I learn and process information, that for me is so helpful, and that I can still get all the information that I need, but it's not just me listening to somebody lecture about the work that they've done, right? And so I think being mindful of kind of that style. How in the past have you maybe overused visual aids, or maybe not used them enough, or maybe you haven't branched out in terms of that? And so I would just encourage you all to just consider some different ways that would help present the information in a way that's more engaging. That's the key component. You have to be mindful of your audience. So explain what the audience should notice, right? So when we're talking about, as you'll notice here, there may be a significant gap between two areas of the research. So being able to explain and share out some interesting findings as well, right? So you're going to present the outcomes and the results, but also, during this showed up over here, and this was quite interesting. And so being able to have those areas of interest or intrigue that may come out of research that maybe you weren't expecting, right? And being able to make that another topic of conversation is going to, again, elicit that engagement with your audience. So highly encourage you just to kind of think through. When I do a presentation, I often find myself back in kind of the early portions of what garnered my curiosity in this? How did I ask these questions to get to the next, right? And so when you can help your audience kind of be in that space as well, that's going to be super helpful in terms of continuing that engagement and continuing that curiosity in terms of any further research that you might be doing in the future. So I've spoken a lot about discussion and implications. So what do the results mean, right? Obviously, after you've done all this research, you've presented it, what does it mean? What is the impact? How are we going to use this data, this information for X, Y, and Z? So making sure that you are, again, explicit in sharing that information out. How are they going to impact healthcare or practice, or, like I said, disease management, patient safety, patient outcomes? So again, being able to tie it to the why. Why is it important that I now have this data? I now have this information. Here's how it can be applied. Here's how it can be utilized. And then what are your next steps, right? So after we did, this research, now with these findings, we're going to start to do X, Y, and Z. We're now going to apply for a grant for this. We are now going to, publish and do these other things. And so again, knowing what your next steps are. And I think that probably will come up in a feedback question as well. Okay, well, now that you've done this, what's next, right? And so your ability to be able to answer those questions, and sometimes you may not know just yet, right? You may still be in that space of figuring out what next might be like, but being ready to answer those questions is going to be really important, even if you don't know. So again, these are going to be those after questions, but it doesn't mean that you don't need to be prepared early on for those types of conversations and follow-up questions. So slide designs, we all know, there's some rules around presentations, and, not for it to be too busy, not too much going on in there. So one key idea per slide, if you're going to do a slide. Same thing on if it's a poster or anything like that. You definitely, obviously the library can help you as well, but you definitely want it to be aesthetically pleasing. You don't want it to be too busy, and they're going to be really good about helping you out with that. Minimal text, right? So few words, not full sentences typically. Again, using graphs and visuals, those visual aids are going to be very important. They're super helpful in really allowing more of that to do the talking than actually you, right? And it's getting a lot of information out outside you just getting up there and talking. And then obviously that accessibility piece, having readable fonts. Again, like us being in this room today, we've got some folks online, but making sure that we are making that accessible. Folks that may be further away from the presentation, things like that. Folks that may be hearing impaired. So just making sure that we are prepared in that way, that we're being mindful of our audience, or some of the challenges that they might be facing as well. So general overview in terms of public speaking, as I mentioned earlier, really and truly what I have come to learn is your nonverbals are going to speak much more loudly than what comes out of your mouth. And I say this in my own experience, but I also say this in observing others, right? I could imagine if somebody came up here for this presentation and had like just a really monotone, y'all are talking, you just ate lunch, you're probably kind of tired now that your belly's full, versus being able to project, right? Be mindful of our eye contact, being mindful of our posture, being mindful of, again, I said facial expressions. Sometimes folks just, their face looks a certain way sometimes, but they don't really understand how other people can perceive that you may not be inviting, that you may not be approachable, right? And so it is really important for us to understand how we might be being perceived, because that may impact how somebody engages with us, right? And so I think a lot of that confidence is for me, is to show up more conversationally. For me, that's where I feel most comfortable. Can I present in a formal way? Absolutely. Absolutely. It is not my preference. Slowing your pace, right? So making sure that we're breathing, that the cadence of our speech is good, that folks aren't having to go, oh my gosh, what did they just say? Because you're speaking so fast. Typically that'll happen when folks are a little bit nervous. They'll kind of speed their speech up because they just want to get through it. They just want to be done and don't want to be up there anymore. And so just making sure that you're doing just an internal check-in, right? I do a top of my head to my toes, like, hey, how's my head? How's my internal talk up here? How's my eye contact? Am I smiling? Am I breathing, right? Are my palms sweaty? So I will literally do kind of just like a biofeedback check-in with myself to be like, hey, how am I doing? How am I showing up? And so I would encourage you all to consider that as well. Pauses are great for transitions. Pauses are great for you to, if you're kind of losing traction of your train of thought, it's a great way for you to just pause and move forward more confidently in that way. And then speak conversationally. As I already mentioned this, for me, this is what empowers me to feel more confidently. And when I'm presenting and when I'm speaking with others, I tried early on in my career to do more of the formal, and that just is not who I am. And that's great if that works for you, right? Some people can do that and do that well, and that is their preference. For me, that's just not how I communicate in general. So trying to kind of show up in that space and do that just really wasn't for me. So again, when you are a little bit more conversational, it does feel a little bit more inviting to the audience. And so just something to think about. And then always like ask for feedback. When you're practicing, whether you're utilizing my office's resources or you're practicing with your peers or your friends or your family members, right? Ask for honest, candid feedback, right? I would much rather somebody tell me, be like, oh, that was not great. Like, here are some things that I would work on if I were you, versus being like, oh yeah, you're great. And then somebody's going to let you go off thinking what you're about to do is great, right? And so all of that to say is, have that support system, utilize your resources, get that feedback from many different folks, right? It doesn't have to be the same people all the time. And here's the other part of that. Lots of people have lots of different opinions, right? But you get to pick and choose what works for you. Be like, no, actually that resonates with me. I actually feel like I would want to do this, or I want to feel more confident in this area. And so again, you might get a lot of different opinions and a range of opinions in terms of things. But at the end of the day, it is going to be up to you to kind of determine what works for you, because what works for me may not work for you, right? So just be mindful of that. Okay, so I've mentioned some of the things in terms of the biofeedback, right? Again, lots of people have anxiety about speaking. Those of us that do it all the time, whether it's something like this, I also teach in higher ed. And so again, practice, right? Making sure that you know your content, because when you don't know your content and you try to get up there and do the thing and you didn't practice, or you're unsure what comes next, or you're unsure of literally how you've strategically put together the time that you're presenting, like that's just adding stress, right? So don't do that. Practice out loud. There are a lot of opportunities even on one of the resources we have within my office called Big Interview. It's for interviewing, but guess what? It has a record where you can literally record anything on there. You could literally record yourself if you weren't comfortable having someone else kind of watch your presentation. I do encourage you do both, right? I do think you can watch yourself, because even in that, watching yourself on video can feel weird and awkward. And so, but you do have that resource. But also, again, having other folks, be there in person, seeing the difference between a virtual presentation and an in-person presentation, right? A lot of times it's a lot harder to sometimes connect and engage in that virtual space. So it's going to be even more important that you're holding eye contact, that you're looking directly into the camera, right? That you're doing these types of things to, again, just to emphasize that you are engaged, that you're having that eye contact in that virtual space. Focus on your message, not perfection, right? Yes, we all want to do our best. We all want to feel great and wonderful and confident, and I nailed that thing, right? But really, what the information that you're trying to translate to someone else, that's really where it is, right? We all have opportunity for improvement every day in everything that we do, even the things that we feel confident in. So again, perfection is not the goal here, right? The goal is to be able to present information in an articulate way, be able to answer those follow-up questions. And again, you will be refining your delivery for years to come. The breathing techniques. So again, I see a lot of folks that either are not breathing or can begin to breathe heavily. So again, that goes back to just kind of checking in with yourself, right? Am I breathing normally? Am I breathing abnormally for myself right now? And just taking those moments of pause when we were talking about the presenting, they're not just there for the presenting, they're also there for you, right? So they're there for you to reset, re-anchor, get back on track if you're feeling like you're kind of going off into left field. So remember those pauses, that it's not just about the actual presentation itself, it's actually there to support you, to give yourself that moment if needed, right? To check in. And again, remember, if you're presenting on research or any other topic, you're there for a reason, right? You're there because what it is that you're speaking to, you're probably pretty high level in that area, if not on an expert level. And so, again, reiterating that confidence is, I'm here to speak about these topics because I am, in fact, through this research, showing you that I am a content expert, right? Or an SME. And so, subject matter expert, there I go using acronyms. So again, just being mindful of you're there for a reason, right? And reiterating that confidence, as you wouldn't be asked to be somewhere if other people didn't see some level of that confidence already in you before you actually did the presentation. So again, I've mentioned some similar strategies around this. So real world healthcare scenarios, right? So really being able to not tie it to hypotheticals, right? So if you can really tie something into a current event, a current issue in healthcare today, or something that we know is up and coming, that is going to be the meat and potatoes of it, right? You want to, again, paint that picture, tell the story, and again, that is going to reinforce that confidence that you have clearly connected the dots as to why this is important. You can also ask reflective questions to the audience, right? So it's not just audience asking you those questions, you can also ask them. And that is a great way to have a high level of engagement with your audience. And so I encourage you to think through some questions that you might want to ask your audience when you're presenting. So taking that time, when I say preparation, it isn't always just about the information. It's also about, how do I want this information to land, and how do I want to engage with my audience as I'm presenting this information? And then the impact, I've spoken about this a couple of times. why did you do this research, and what were you hoping to do with it? What gap were you hoping to fill? What problem were you hoping to solve? Your ability to share that out and do that at a high level is going to be very important to the success, right, of the time that you're spending in front of folks that either are stakeholders, policymakers, other folks that you might collaborate with research on in the future. And so just being mindful of that as you kind of enter that space, I think is also going to be really impactful. So handling questions, obviously you want to listen carefully, so that active listening, allowing folks to ask the question fully before you begin to respond. I'll be the first one to say that I get really excited when I'm passionate about something and I want to just dive in and start talking before maybe they're finished either asking a question or sharing a comment. And so again, that active listening piece is going to be really important for you to garner that entire context. Clarify if needed, right? Like if you're unsure of portions of a question, just reiterating. So am I understanding this correctly? So I believe the question that you're asking me is, right? So just asking them back exactly what you processed. So that's a great way to just make sure that you are understanding the question fully. Answer concisely, right? I think being explicit and direct in your response is going to keep it timely. It's going to directly answer the question that you're being asked. And then I always like to follow up. Did I answer your question appropriately? Did I fully answer your question? Just making sure I didn't miss any key parts of that, right? Because we can accidentally skip over portions if it's a complex question. And it's okay for you to not know. Okay? Full disclosure, you cannot know. The best way to respond to that is, you know what? That's a great question. I'm going to follow up with you. I need to do a little bit more digging. I need to do a little bit more research on that before I feel confident answering that question. And I don't know is okay. I would much rather I don't know it than try to finagle something you may not really know, right? So just know, nobody knows everything. And even when you are asked a question, if you don't know, please acknowledge that. Take that as an opportunity to say, you know what, I don't know, but I'm going to find out and I'm going to get back to you. So again, that confidence is people appreciate when you don't know something and that you are like, you know what, I actually need to look more into that. And then when you follow up, that's just going to show your commitment to it. You're doing what you say you're going to do. You're believable, right? And so again, it's okay for you to say, "Can I follow up with you on that?" If there's something you're not confident in. Okay. We have just a few more minutes, and so if y'all want to work through this, I'm happy to do it. But I just put a little 60-second exercise in here. I know we don't have too many folks, but I had this in here because I do always think that hands-on learning is helpful to me. But if anybody has any research that they've done or done a presentation or you're planning on doing that, if you want to work with a partner for 60 seconds, explaining your research to somebody in 60 seconds. So it's kind of like an elevator pitch for your research. And your key focus items would be, what's the problem that you're solving? What is your key finding? And why does it matter? If you don't want to do it today, we'll say this. This is my challenge to you. Here's your takeaway. Practice this. Use just these 3 questions and 60 seconds to figure out how well am I articulating the presentation or research I'm doing. Practice this with somebody else. We don't have to do it today. Practice it with somebody else and see how much you think you knew about your ability to share that information out and where you might find opportunity to do a little bit better or maybe be a little bit more have a little bit more context or information, or how maybe you can be a little bit more concise, because some of us can get wordy, right? And so again, great little exercise. And I think this is a great way for you to continue to kind of use this as you're working toward any other research or presentation that you're going to do to really just understand actually where you stand in it. So great little exercise if y'all want to try that out in the future. And then lastly, this is just my team. We're small but mighty. Shameless plug. We are all certified career services providers. And so we have a national certification in career development. And so we are all certified at a very high level to do all of those things that I mentioned early on in my presentation. And so if y'all have questions or you would like to tap into those resources, you can reach out to anybody on my team. We're all highly competent and qualified. You can also reach out to the Career Center email if you have additional questions or unsure if there's an offering that we might have. And then our website is also there as well. That concludes my time with you all today. I would love to open it up for a couple of minutes of Q&A or commentary, comments, questions, or concerns. But I just want to appreciate y'all for being here today. And again, want to just give y'all a few minutes if you have any questions. Yes.
I feel like one of my big struggles is trying to balance for the audience and providing a more specialized versus general, especially at a conference.
Yeah.
I study neuroscience, and so depending on which direction you take from it, some people know a lot, some people might not. Which aspects would you start to kind of what would you shade down and what would you have more depth of?
That's a really good question. And when I mentioned earlier about like the jargon and like some people like me have a more in-depth knowledge base about exactly what you're talking about or presenting on. I do think that when you offer, I'll be happy to stay back and chat with folks if you have those more in-depth questions. I'm happy to answer any general questions. I think kind of guiding folks that may have some more in-depth questions, want to talk really in depth, but that's not necessarily something the entire audience want to engage in. That's a great way for you to go ahead and put the offer out there, right? Hey, I'm going to be over here off to the side after our time is done. I'll be happy to continue the conversation. And if you have any more questions that I can further assist on. So I think kind of guiding the audience in that way. I tend to say, I don't want to say stay more general, but I think it could take away from the general audience if you start to get into the nitty gritty in front of everybody, and that can kind of just like veer it this way. And so when you just put that out there, I'll be happy, or you can even say that at the beginning of the presentation, right? You can even say, hey, so to let everybody know, at the end of my presentation, I'm going to step off over here to the side. I'll be happy to continue conversations or questions that you may have to further your knowledge or for us to connect further. And so I think that's a great way to just kind of set the expectation and set the stage early on. And that way you're not feeling like, oh, I didn't give this person in the audience this, and I didn't give this person. You're giving those folks that do want to have that more in-depth opportunity, a more intimate and personal time after the fact. Does that make sense?
Yeah.
Okay. Yeah, for sure. That's a great question, because that can be difficult sometimes. Any other questions? Who's presented in here before? Who's hoping to present? Okay. Awesome. Well, again, if y'all want to practice, y'all want to get additional assistance in that, we will be more than happy to work with you all on that. And again, if y'all have questions and you're not sure if it is my area, please ask us. I'll be happy if it doesn't have to be somebody in my area to get you to somebody that I think might be more of the right person. But I appreciate your time today. I hope you all feel a little bit better and a little bit more confident about showing up and knowing some key aspects of doing presentations well. And again, I'm here to support you, so is my team. And so if y'all have any follow-up questions or you want to meet with us, please don't hesitate. That is it for me. I hope y'all enjoy the remainder of your day. Thanks for spending your lunch hour with me and eating some pizza. And I too am happy to chat further.